Hi everyone. Today I am going to discuss about topic of shock. What are the clinical manifestations, their management and all we can cover in this topic. So let us enter into the topic. Definition of shock. Do you have any idea about this word shock? Shock is a life threatening condition that occurs when the body is not getting enough blood flow. Whenever the blood supply to the body or any other organs, whenever the flow is not good, then this shock will happen. Lack of blood flow means the cells and organs do not get the enough oxygen and nutrients to function properly. Whatever the normal mechanism must go on, it was interrupted during this period. Thus, it leads to finally shock. Whatever the oxygen supply and nutrient supply in order to function properly, here the main function interrupts. Whenever the person is in shock, we need to monitor the patient and we need to give the immediate management when the patient had undergone shock. Types of shock. Mainly it is subdivided into four types of shock: obstructive shock, cardiogenic shock, distributive shock, and hypovolemic shock. First of all, what is obstructive shock? Obstructive shock means it is a condition that prevents the blood and oxygen from getting to your organs. Whatever the blood supply or oxygen supply to the different body organs, here what happens, it will prevent the blood flow and oxygen supply. That is the obstructive shock. There will be the obstruction to that flow. Next, second one, cardiogenic shock. Cardiogenic shock means it is a life threatening condition. Here what happens, heart suddenly can't pump the enough blood to meet the body's needs. It is often caused by a severe heart attack. But the person, whoever is having a heart attack, has cardiogenic shock. It is a rare condition. Next, third one, distributive shock. Distributive shock means it is also known as vasodilatory shock. Here, what happens? It is one of the four broad classification of disorders. It causes inadequate tissue perfusion. Whatever the supply will be there, that it interrupts. Decreased arterial blood flow to the extremities, that causes the distributive shock. Final one, hypovolemic shock. Hypovolemic shock, it is an emergency condition. Here, the severe blood or other fluid loss, it makes the heart unable to pump the enough blood to the body. Here, normal supply, whatever the normal supply will be there, here the supply will be interrupted. The normal supply will be interrupted. That happens because it unable to pump the enough blood to the body. That is hypovolemic shock. Signs and symptoms of this shock. Here, what are the clinical manifestations we can observe in the patient who is suffering with the shock? Rapid, weak or absent pulse, irregular heartbeat, lightheadedness, cool and clammy skin, dilated pupils, lackluster eyes, chest pain, nausea, confusion, anxiety, decrease in the urine formation, thirst and dry mouth, low blood sugar, and the loss of consciousness. Due to the continuous decreased supply of blood supply to the body organs, these all clinical manifestations will appear in the patient. By observing all these clinical manifestations, we can easily identify that the patient is suffering with the shock symptoms. Pathophysiology of the shock. First of all, here, due to the inadequate perfusion means there will be the decreased arterial blood flow to the extremities. There will be cell hypoxia. Cell hypoxia means it is the condition where the oxygen demands exceeds the oxygen supply. Whatever the oxygen supply was there, it exceeds, then leads to energy deficit, lactic acid accumulation, and there will be the decrease in the pH values, leads to anaerobic metabolism. If continuously it decreased pH and there will be further formation of the lactic acid, it the person may enter into metabolic acidosis. Due to that metabolic acidosis, there may be cell membrane dysfunction and failure of sodium pump or vasoconstriction will happen that further leads to failure of precapillary sphincters or peripheral pooling of blood. But if the cell membrane dysfunction was there and sodium pump failure happens, means there will be the lysosomal release. It causes the efflux of potassium and influx of sodium water. Thus, these intracellular lysosomes release the toxic substances. Thus, it enters in circulation. Finally, it causes the damage of the capillary endothelium. Finally, due to the cell dysfunction and destruction, ultimately the cells undergo death. It is the pathophysiology of the shock. Management of shock. Nursing interventions. Management in all types and phases of the shock. Here, whatever the types of shock was there, management it includes in all types of shock, like in obstructive, cardiogenic, distributive and hypothalamic. Continues these all shocks requires immediate management. Basic life support. CPR is immediate and emergency management in case of this shock. CPR plays an important role when the patient had undergone any shock or fluid replacement. Intravenous fluid replacement is compulsorily needed in case of patient who had undergone shock, because as there is a fluid deprivation, so the patient immediately needs the fluid replacement. Vasoactive medications. Vasoactive medications are the substances that not only intends to improve the systemic hemodynamic variables, but it also ultimately attenuate the dearrangements of organ perfusion. Thus, it causes the oxygenation during the shock. Thus, it mainly acts to give the oxygenation to the different parts of body. Nutritional support. As the patient had undergone in shock, he immediately needs the nutritional support. Otherwise, the patient may get further deteriorated. Mainly, it includes three aspects: monitoring, fluid therapy, and the vasoactive agents. Monitoring means we need to monitor each and every system, including respiratory, cardiovascular, neurological, temperature monitoring, diuresis monitoring, and monitoring of arterial gas analysis. Respiratory system. Coming to respiratory system, we need to monitor for respiratory rate per minute. What was the respiratory pattern the patient has undergone? By using the pulse oximetry, we need to monitor the patient pulse. Next, coming to cardiovascular monitoring, we need to monitor the pulse rate and rhythm. Then neurological monitoring, state of conscious level, whether the patient is conscious, unconscious or semi-conscious, like this, all stages we need to observe. Then temperature monitoring, measurement of peripheral or core temperature. Thus, it helps to identify whether the patient had undergone any shock or any other sepsis. Diuresis monitoring, hourly monitoring of the urinary output and elimination patterns, like that we need to completely monitor the patient. Finally, monitoring of arterial gas. In that, arterial blood gas analysis plays a major important role to know the cell hypoxia and blood gas analysis. Second one, fluid therapy. Here, the fluid replacement is compulsorily needed in case of shock. For adults, 1 liter of crystalloid, 5 to 10 ml per kg of colloid, or the patient is reassessed for any other abnormalities. Then vasoactive agents. Vasoactive agents, it not only intends to improve the systemic hemodynamic variables, but it also attenuate the dearrangements in the organic perfusion. Thus, it induces the oxygenation during the shock. So here we had seen all the aspects regarding the types of shock, what are the clinical manifestations, how the pathophysiological changes will undergone in shock, and finally the management of shock. Thank you.